House Leader, third party.
Thank you, Honourable Speaker. And just to the conversation that's just happened, I do want to say in Cowichan we have really appreciated the collaborative efforts of BC Housing and the Minister on addressing the very serious needs of people without homes in our region. Here in BC, we have been lauded for our tremendous response to the COVID-19 pandemic. By working together, using current research, fast active, and an effective communication, we've largely been able to keep the virus in check. Unfortunately, citing emerging data, the United Nations recently declared that a mental health crisis is looming and will be the pandemic that nations will have to confront. Indeed, for many British Columbians, this pandemic is already taking a huge toll on their mental health and well-being. Data from the BC Psychological Association, where over 200 registered psychologists have been donating their time to provide care during this health emergency, reported that 2/3 of their 800 callers are experiencing either moderate or severe levels of distress. These findings are also consistent with government's recently released data that indicates 47% of the nearly 400,000 people surveyed say their mental health is currently worsening. My questions for you, Honourable Speaker, is to the Minister of Health. I expect that the Minister agrees that health is not just the absence of disease, but rather includes physical, social, and emotional well-being. Given this, what immediate steps are being taken to incorporate this definition, which includes mental health, into our healthcare delivery?
Minister of Mental Health and Addictions.
Thank you, Honourable Speaker, and thank you to the member, the House Leader for the third party for her question. There is absolutely no doubt that COVID-19 has affected the mental health of the entire province, of the country, of the world, and it has been very, very traumatic, especially for people who are already struggling with mental health and addictions issues. Those issues have become exacerbated as a result of this crisis, and that's why, Honourable Speaker, within 3 weeks of the pandemic being declared, we had worked with our partners, with CMHA-BC, with community counselling agencies, and very closely with the BC Psychologists Association in order to stand up access to virtual services. And I want to, I take my hat off to the BC Psychological Association because they stepped up with 200 psychologists offering free counselling to people across the province. And they've done incredible work, and it has made a difference, Honourable Speaker. But we know, as with natural disasters like floods or fires, and this pandemic, we know we're not out of it yet. We know that people are still struggling with mental health issues. We know that substance use and use of alcohol is going up. And we know that we can expect what is referred to by the experts as an echo pandemic. And that's why, literally, as we speak in our ministry and working across government, we are working to put in plans place about what further supports we need for people struggling with mental health issues as a result of COVID-19 going forward. But some of the supports that we put in place, some were available for the entire population, families struggling with kids at home, but also a specific focus on healthcare workers, Honourable Speaker, because they, as we all know, have been doing absolutely yeoman's duty and taking a lot of the stress and the tension and the anxiety onto themselves. And so we've stood up some particular programs that are about support for healthcare workers, and we will continue to support them and making sure that we have programs in place going forward to support British Columbians. Happy to hear the members' ideas about what that looks like.
House Leader, third party on a supplemental.
Thank you, Honourable Speaker. And I appreciate the Minister's response, and we will be coming forward with ideas over the course of the week. Since the first COVID-19 case was diagnosed, 16.5 million people around the world have contracted the virus, and tragically 650,000 have died. Even in the time since we drafted this question on Friday, that number went up by 2 million cases. The trajectory on COVID-19 is a very distressing one. Worryingly, new modeling in the United States estimates that an additional 75,000 deaths will occur due to substance abuse and suicide as part of the COVID-19 fallout. This is already a reality in our province, with June setting a horrific record of 175 deaths from toxic drug poisoning. How we've dealt with the COVID-19 global pandemic juxtaposes our treatment of the opioid pandemic that is ravaging our province. 728 people have died so far in 2020 from toxic drug poisoning. Mothers, fathers, sons, daughters, friends, and neighbors. My questions for you, Honourable Speaker, is to the Minister of Mental Health and Addictions. Can the Minister identify the areas that lacked the support to help avoid this tragedy, and what immediate steps government is taking to ensure that the coming months don't set any more unwanted records?
Minister of Mental Health and Addictions.
Thank you, Honourable Speaker, and thank you again to the member for the question. And I think the member is very well aware that the coroner has been really clear that the primary cause of the spike in deaths is as a result of a toxic drug supply, more toxic than ever before, lethal combinations of drugs. And we know that we were making progress, and Dr. Bonnie Henry has certainly acknowledged that we were moving in the right direction as far as the supports that we were providing people in the BC CDC estimated that 6,000 deaths were averted as a result of the interventions of this government and the thousands of people on the front lines. But when it was clear that the threat was there of the numbers going back up, again, we moved very, very quickly, as the member knows. We brought in risk mitigation guidance so that we could improve access to a safe supply of prescription alternatives to the poison drug supply, critically important to separate people from that poison drug supply on the street. But at the same time, Honourable Speaker, we are working on building a continuum of care. We've just announced new treatment beds. We've announced substance use integrated teams. Because, Honourable Speaker, what we've learned also from the coroner is that in the past year, often before people have died of overdose, 4 out of 5 of them had been in contact with the healthcare system. 4 out of 5. So we need to connect with those people. We need to stay connected with those people. So substance use integrated teams that will be in place across the province are going to do exactly that. Honourable Speaker, later this week we'll be making some more significant announcements. I don't want to, make the announcement before we make it, but we've been working really hard with the First Nations Health Authority on new treatment facilities, Chilliwack Youth Centre, and there's much more to come, Honourable Speaker. We know we need to strengthen the continuum of care that frankly was left in very, very bad shape by the previous government. At the same time as we respond to this overdose crisis, we are not taking our foot off the gas, and we won't until we turn the tide on this terrible crisis.